This combination of vitamins provides vitamin B6, vitamin B12 and folic acid to people who do not have enough of these vitamins for good health. Folic acid helps your body produce and maintain new cells, and also helps prevent changes to DNA that may lead to cancer. Vitamin B6 is important for normal brain development and for keeping the nervous system and immune system healthy. Vitamin B12 is important for the brain and nerves, and for the production of red blood cells. It also helps maintain the health of nerve cells and helps make DNA. The recommended daily dosage for adults is 400 micrograms of folic acid, 1.3 to 1.7 milligrams of vitamin B6, and 2.4 micrograms of vitamin B12. It is best to take this combination of vitamins with food to help with absorption. When taking folic acid-Vit B6-Vit B12, it's important to take it by mouth, with or without food, usually once daily or as directed by your doctor. If you experience any stomach upset, it may help to take this product with food. Using this medication regularly is essential in order to get the most benefit from it. To help you remember, try to take it at the same time each day. The dosage is based on your medical condition and response to therapy, so it's important to follow your doctor's guidance. Some common side effects of taking folic acid-Vit B6-Vit B12 supplements include nausea, stomach upset, diarrhea, drowsiness, flushing, and numbness/tingling. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that if your doctor has prescribed this medication, they have determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, it's important to contact your doctor right away if you experience any serious side effects, such as mental/mood changes or unusual weakness. While a serious allergic reaction to this medication is rare, it's crucial to seek medical help immediately if you notice any symptoms of a serious allergic reaction, like rash, itching/swelling, severe dizziness, or trouble breathing. It's also important to note that this is not a complete list of possible side effects, so if you experience any other effects not listed, be sure to contact your doctor or pharmacist. And if you have any concerns about the side effects, be sure to discuss them with your healthcare provider. As always, it's important to follow your doctor's guidance on the appropriate dosage and timing for taking folic acid-Vit B6-Vit B12 supplements. Before starting the folic acid vitamin B6, vitamin B12 supplement, it's important to talk to your doctor or pharmacist if you have any allergies or if you have a history of certain blood disorders. This supplement may contain inactive ingredients that could cause allergic reactions or other issues, so it's essential to have a conversation with your pharmacist to understand more about it. This supplement may cause drowsiness, and it's important to note that alcohol or marijuana, cannabis, can intensify this effect. It's crucial to avoid driving, operating machinery, or any activities that require alertness until you know how this supplement affects you. Also, it's advised to limit alcoholic beverages and to consult your doctor if you are using marijuana, cannabis. If you are pregnant, it's important to discuss with your doctor if this supplement is necessary for you. The risks and benefits should be carefully considered before using this supplement during pregnancy. For those who are breastfeeding, it's recommended to consult with your doctor before using this supplement to understand the potential effects it may have on breast milk. It's important to be aware of potential drug interactions when taking folic acid vitamin B6, vitamin B12. Some products that may interact with this drug include altretamine, cisplatin, levodopa, when used without carbidopa, folic acid antagonists, such as methotrexate, and hydantoins, such as phenytoin, diphenylhydantoin. Additionally, this product may interfere with certain lab tests, possibly causing false results. It's important to inform lab personnel and all your doctors that you are taking this product. As for the benefits, folic acid vitamin B6, vitamin B12 can help support the production of red blood cells, aid in the conversion of food into energy, and support the nervous system. The daily dosage varies depending on age and gender, but it's best to consult with a healthcare professional for personalized recommendations. As for the best time to take this, it's generally recommended to take it with food to help with absorption. If someone takes too much of this medication and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call 911 or the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control centre. It's important not to share this medication with others. While taking this medication, your doctor may want to do lab and/or medical tests such as complete blood count and checking homocysteine levels. It's important to keep all medical and lab appointments and consult your doctor for more details. Remember that it's best to get your vitamins and minerals from healthy foods. B vitamins, including folic acid, can be found in leafy greens, other vegetables, and citrus fruits. Folic acid is also found in enriched grains such as bread, pasta, and cereal. Maintaining a well-balanced diet and following dietary guidelines as directed by your doctor is important. Some brands of this medication may also contain additional ingredients such as vitamin E, para-aminobenzoic acid, or alpha-lipoic acid. If you have any questions about the ingredients in your brand, consult your doctor or pharmacist. If you happen to forget a dose of folic acid-Vit B6-Vit B12, take it as soon as you remember. However, if it's almost time for your next dose, then it's best to just skip the missed one. Just continue with your regular schedule for the next dose and avoid taking double the amount to make up for the missed one. It's important to stick to the recommended dosage to ensure the effectiveness of the medication. When it comes to storing folic acid-Vit B6-Vit B12, it's important to keep them at room temperature and away from light and moisture. It's best to avoid storing them in the bathroom and to keep them out of reach of children and pets. When it comes to getting rid of any unused or expired products, it's important not to flush them down the toilet or pour them into a drain, unless instructed to do so. Instead, it's best to properly discard them and consult with a pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.